Thanks for joining us today for this video blog. We're going to do a before and after video. This is a patient of mine, Joe Tarantolo. I haven't seen him for a few months. And he called in earlier today. What's the problem going on?
Well, Steve, as you know, my back sometimes has a tendency, or my hips kind of pop out of joint. And when I do that, I'm susceptible to throwing out my back. So it's a little tender. I like to get the hips thrown back in a joint so my legs are even.
Okay. So we're going to see, are you hurting today?
It's a little tender, yes.
Okay. So we're going to adjust him in a few moments, and then we'll see how he does, and we'll just do we'll continue this blog right after the adjustment. Okay, we'll see you in a few moments. So Joe, tell me, where are you hurting?
Right in here is a little tender.
Okay. How's this in here?
Okay.
And how's this in here?
Okay.
Any pain either place?
When you're pushing here, I felt a little bit.
When I press here, you feel it up here. Anything locally where I'm pressing?
Not really, no.
Okay. But on both sides?
Yes.
Okay. So as you can see, he's got tenderness on both sides of his low back. Now we're going to take a look at his leg length. And if we check his leg length, you'll see that he's got a short right leg. So, if you can see that, we're going to adjust him. So we're going to adjust him for a short right leg, and I'll check out his lumbar spine and see if the vertebrae are out of place. I'll use a muscle testing technique for that, and then we'll adjust him and see how he does. Okay. Okay, so now we know that Joe's got a short right leg, his hips are out of place, and his lumbar spine is out of place. Joe, I want you to lie down on the block, and I want the left hip to hit right here, and just lie straight down. Good. Stay just like that. And now we're going to take the camera and come right over here and check the leg length and see if that's changed. Now, if you notice, this has overcorrected a little bit, slightly. Now he's got a slightly short left. So we're going to let him lay here for a few moments and let his weight and his breathing adjust his hips by himself. Because we got him properly positioned on the block. Oh, okay, Joe?
Yes.
Come on up and let's see how that feels. Now I want you to walk around a little bit.
Feels a lot better.
Does it? Okay. Now bend and move a little bit. How is that?
Good. Yeah, I don't feel it. I don't feel that tenderness and soreness on my back, you know, in the movement.
Good. All right. Any pain left at all, or?
No, feels
No.
good.
Okay,
Feels
great.
good.
Great. Now Joe is not a small fellow, and I have a fee plan for bigger men. Anybody over 250, I charge $10 extra. Thanks.
Verbal abuse not included.